Welcome to our exploration of how early parental death shapes adult relationships. This topic is both sensitive and deeply impactful, touching on emotional development, attachment, and resilience. We'll dive into recent research, uncovering surprising findings about the long-term effects of losing a parent during childhood. As we journey through the data, we'll see how these experiences influence relationship stability, emotional health, and even the ability to love. Let's begin by understanding the basics and setting the stage for a nuanced discussion about grief, coping, and connection. Sigmund Freud's classic description of melancholia provides a powerful lens for understanding the emotional aftermath of early parental loss. He described profound dejection, loss of interest in the world, diminished capacity to love, and self-reproach as hallmarks of grief. These mental features can deeply affect a child's development, influencing their ability to form healthy relationships later in life. As we move forward, keep Freud's insights in mind. They help frame the psychological challenges faced by those who lose a parent early. Early parental loss is not as rare as one might think. Approximately 5% of the population experiences the death of a parent during childhood. This event can disrupt the family system, affect attachment, and pose risks for complicated bereavement. Understanding how common this experience is helps us appreciate the importance of research into its long-term effects. As we continue, we'll see how these early losses ripple through adulthood, influencing relationships and emotional health. Research shows that adults who experienced early parental loss are more likely to face depression, anxiety, and substance use disorders. They often use maladaptive coping strategies such as self-blame, self-medication, and emotional eating. In contrast, those raised in intact homes tend to fare better socially, financially, and academically. These differences highlight the profound impact of early loss on mental health and underscore the importance of supportive interventions. Attachment theory suggests that early parental loss can disrupt a child's ability to form and maintain healthy relationships. The loss may lead to attachment insecurity, making it harder to trust and connect with others. This insecurity can manifest in adulthood as difficulties with intimacy, commitment, and emotional regulation. As we examine the research, we'll see how these attachment challenges play out in real-life relationships. Despite the significance of early parental loss, there has been surprisingly little research on its effects on adult relationships. Previous studies have yielded inconsistent results, with some suggesting lower marriage rates among those who lost a parent early, especially women, while others found women tended to marry earlier. The gender of the deceased parent and the age at loss are also unclear factors. This lack of clarity underscores the need for large-scale, comprehensive studies. Researchers have posed several important questions. Does early parental loss lead to shorter relationships or higher divorce rates? Does the cause of death, such as suicide, make a difference? Is maternal loss worse than paternal loss? Does losing a parent at a younger age result in poorer outcomes? These questions guide the search for answers and help shape the direction of future studies. To address these questions, Høeg and colleagues conducted a large-scale study using Danish population databases. They analyzed data from over 1.5 million people, cross-referencing information on sex, age, parental death, family status, income, education, and psychiatric illness. This comprehensive approach allowed them to identify significant patterns and draw robust conclusions about the effects of early parental loss on adult relationships. The study found that 4.5% of participants had experienced early parental loss. Most cases involved the death of the father, and 12% were due to suicide. About half lost parents during their teenage years, while the other half experienced loss earlier. Parental loss was more common in families with psychiatric problems, lower income, and lower education levels. These demographic insights provide context for understanding the broader impact. Among the 1.5 million people studied, nearly 430,000 men and 440,000 women had started relationships. Of these, over 21,000 men and almost 20,000 women had experienced early parental loss. The researchers found no difference in the rate of long-term relationships among men, but bereaved women were 9% more likely to have long-term relationships. Both men and women were more likely to be in relationships if the parental death was from suicide. Interestingly, the sex of the deceased parent made no difference for relationship status. This finding challenges assumptions that maternal loss is worse than paternal loss. It also suggests that family dynamics and support systems may play a larger role than previously thought. As we continue, we'll explore how these patterns influence relationship stability and duration. The study also examined relationship endings, including divorce and separation. Of those who started relationships, nearly 209,000 men and over 218,000 women experienced separation, with almost 11,000 men and 12,000 women having lost a parent early. Both bereaved men and women had higher rates of ending long-term relationships compared to non-bereaved people, and bereaved men were more likely to have relationships end than bereaved women. On average, relationships for people without early parental loss lasted 2 years longer, 6 years versus 4 years. Bereaved men had a modestly higher rate of separation, 13%, than bereaved women, 9%. Relationships were more likely to end earlier when the parental loss was from suicide. However, there were no differences in relationship duration between maternal and paternal loss. Bereaved women were more likely to begin relationships at a younger age. Similarly, people who lost a parent to suicide started relationships younger, but those relationships tended not to last as long. This pattern suggests that early loss may accelerate the pursuit of intimacy, but also introduce challenges to sustaining long-term bonds. Surprisingly, there were no differences found between maternal versus paternal loss in terms of relationship, start date, or duration. This finding challenges gender-biased assumptions and highlights the evolving understanding of parental roles. Recent studies emphasize the importance of fathers, especially during adolescence, and suggest that family support after maternal death may buffer negative outcomes. Family support systems play a crucial role in mitigating the effects of parental loss. Men are more likely to remarry, which can provide greater family support after maternal death. This support may help children cope and reduce the negative impact on relationship outcomes. Understanding these dynamics is key to designing effective interventions for bereaved families. Although the study did not report on parent-child gender interactions, it's possible that maternal and paternal loss may have different effects on boys versus girls. This area remains underexplored and could reveal important nuances in how children process grief and develop relationship skills. Future research should investigate these gender-specific impacts. It is surprising that the study found no difference in relationship outcomes for people who experienced loss earlier in childhood. One might expect that younger age at loss would lead to poorer outcomes, but the data did not support this assumption. This finding suggests resilience and adaptability among bereaved children, regardless of age at loss. Parental suicide had a distinct impact on relationship outcomes. Bereaved individuals were more likely to start relationships younger, but those relationships tended to be less stable and shorter in duration. The emotional complexity of suicide loss may contribute to these patterns, highlighting the need for targeted support and counseling. Overall, adults who experienced early parental loss have higher rates of health and emotional issues, but most are able to find and maintain adult relationships. However, these relationships are somewhat less stable, suggesting a level of attachment insecurity. Despite the challenges, the majority demonstrate resilience and adaptability. The relatively low level of relationship difficulties among bereaved adults tells a story of resilience. Despite higher rates of emotional and health issues, most are able to build and sustain meaningful connections. This resilience is a testament to human adaptability and the power of supportive environments. Future research could focus on the quality of relationships and attachment style, correlating outcomes with mental and physical health. Factors such as the quality of grieving, culture, and family coping mechanisms may play significant roles. Identifying those most at risk and understanding their needs will help guide effective interventions. Complicated or unresolved grief can lead to more problems in adulthood. Those who struggle to process their loss may face greater challenges in forming and maintaining relationships. Identifying these individuals and providing targeted support is essential for promoting healthy outcomes. Culture and family coping strategies significantly influence how children process parental loss. Supportive environments, open communication, and healthy grieving practices can buffer negative effects and foster resilience. Understanding these cultural and familial factors is crucial for designing effective support systems. Therapists play a vital role in helping individuals cope with early parental loss. Counseling, support groups, and targeted interventions can address attachment insecurity, complicated grief, and relationship challenges. Access to mental health resources is key to fostering resilience and promoting healthy relationships. Adults raised in intact homes generally enjoy higher quality of life, better health, and greater academic achievement. In contrast, those who experienced early parental loss face more challenges, but many still achieve meaningful relationships and success. These comparisons highlight the importance of support and intervention. Academic achievement is often higher among adults raised in intact families. Early parental loss can disrupt educational progress, but with proper support, many bereaved individuals overcome these challenges. Education is a key factor in long-term well-being and relationship success. Health outcomes are generally better for those raised in intact homes. Early parental loss is associated with increased risk of mental health and substance issues. However, resilience and access to resources can mitigate these risks, enabling many to lead fulfilling lives. In summary, early parental loss has a modest impact on adult relationships. While bereaved individuals face higher rates of emotional and health issues, most are able to find and maintain meaningful connections. Relationship stability is somewhat reduced, but resilience and adaptability are common. Support systems, culture, and therapeutic interventions play crucial roles in promoting healthy outcomes. As we conclude, it's clear that early parental loss shapes adult relationships in complex ways. The majority of bereaved individuals demonstrate remarkable resilience, but targeted support is essential for those struggling with attachment insecurity or complicated grief. Future research should continue to explore the nuances of relationship quality, attachment style, and the influence of culture and family coping. By understanding these dynamics, we can better support those affected and promote healthy, lasting relationships.